is what we have. So for your second MBBS examination, we have 60 MCQs, 6 SCQs for the gross anatomy part, and also sports 40, histology sports 10, and Viva. There's a Viva. There's a question. There is a question discussion for 7 minutes, like that, and you may have completed your continuous assessment in your modules, and those marks also will be added to your examination. Now, so we have 60 MCQs. So true, false, we have to mark whether it's true or false. And SCQs 6, like that. So this is the written paper for that. So the time management is very important. So they will give a particular time for a particular MCQ as well as for a particular SCQs. So this is the format you have. So remember, if you are given, you have 60 MCQs, then if they are giving 2 hours to complete this task, then you only have 2 minutes per MCQ. So within that 2 minutes, you have to mark whether it's true and false and move to the next MCQ. So imagine you have 6 SCQs, and if they are giving 3 hours for this one, so you have to limit your time half an hour for a SCQ. Like that, you have to manage your time. So we will be discussing on this Viva and Strogi and every skills also. So we will go first for the SCQs. Then we will identify how to write the exam answer for your paper. So here we will be discussing the sample SCQs and also sample MCQs to identify what are the tips for this SCQs and MCQ. So here, if you see SCQs, you have to identify the keywords. Okay, so you have to be very careful about these keywords. So the questions will start with define, otherwise the classify and explain, and sometimes the differentiate and list, and maybe describe and discuss, sometimes outline, otherwise the draw and state. So like that, you the questions, otherwise SCQ, the part of the question will start like this. Then by looking at this word, you have to understand what am I going to write. Okay, so if they ask you to list, and if you are going to write as a paragraph, big part of your answer paper, so you will get the marks, but the time is the problem. Okay, so sometimes they will ask list the 5 features of facial nerve palsy. Then you have to put 1, 2, 3, 4, and 5 and just list those things. Do not write the paragraphs and describe each and every clinical features, and you won't get additional marks for that. You will waste your time on that particular SCQ. So you have to remember that one. So if you are supposed to describe, and if you list the thing, then also you will lose the mark. So please read the first wording in your SCQ paper, SCQ question. So we have to pay attention to whether the question asks for definition, mechanism, management, anything we have to identify. So that's the first thing you have to do when you see the SCQ. Then the second tip, plan before writing. This is very, very important. So imagine, for example, so you won't get this kind of question in this era, but remember, if you are supposed to describe the gross anatomy of the thyroid gland, for example, then now you have to write the gross anatomy of the thyroid gland and you have to formulate the structure for that answer. So you should have a plan. So take at least 20 to 30 seconds to organize your thoughts. And if you have extra papers, just take that one and write. For this answer, I'm going to write for the gross anatomy of thyroid gland. The first thing I am going to write the introduction regarding thyroid gland and what other things we will see. So like that. So we have to give the definition. Okay, so we will think what is thyroid gland, what is it doing, and what is the function of that. We can apply that thing. So etiology doesn't matter here, but for some question it will matter. So etiology is there. Then pathophysiology, clinical features, diagnosis, and the treatment. So this is the basic concept. So we will see how to apply for the gross anatomy. So we have to tell the first thing is we have to give the introduction. Okay, then after the introduction, we have to build the core of the anatomy equation. So equation is regarding the gross anatomy. Then what we have to do, after the introduction, we are going to tell the anatomy. So then first thing we have to tell the relations. So what are the things we have to tell regarding the relations of the thyroid gland. So that's the second point. So we have to remember this format, okay? The first thing is the introduction and second part is the core. Within the core, the first thing we have to tell the relations. And in case of it's a nerve, we have to tell the cause. So if you are supposed to describe the anatomy of the median nerve, so we have to tell the cause. So how it is originated and how it descends downward through the upper limb and how the median nerve branch into the its branches in the arm, forearm, and dorsal. So that's the second part. And after that, so if you are within the core, then again back to the thyroid anatomy. So we have to describe the blood supply of the thyroid gland. So this is an example I am giving. So for the blood supply, you have to tell, remember this one, if you are supposed to describe the blood supply, you have to tell the arterial supply and the venous supply also. So these two we have to discuss. And as at the same time, you have to tell about the venous drainage and ultimately you have to tell about the nerve supply of the particular structure. So for example, again, the thyroid gland. And finally, so if you are supposed to write the gross anatomy, otherwise the short notes regarding some particular structure, please remember at last, you have to add some point regarding how this organ is important in your clinical practice. So remember, in case of thyroid gland, you have to write something why we are learning about this thyroid gland, because thyroid gland, it will undergo a procedure called thyroidectomy. So we are removing the thyroid gland because it may have the cancer. So this is a common scenario. So it has a cancer. So like that. Otherwise, when we are, sometimes it will have some hypothyroid condition. So with a few sentences, you have to write regarding those things. So for another example, so you are writing a short note regarding the median nerve, otherwise the radial nerve. So now you have described the introduction for the radial nerve and you have given the relations for the radial nerve and you have given the branches of the radial nerve. So here we are not going to describe the arterial supply and those things. So we describe the distribution of the radial nerve up to the last part. Then ultimately we have to tell why we are learning about this radial nerve, because there are some clinical conditions called such as the wrist dropped and how the radial nerve can be damaged in the various part of the upper limb. So 2 or 3 sentences we have to add the end. So remember, if you don't follow this format, okay, so if you don't follow this format, so they have the answers with, when they are checking your answers, so marking your answer, they have the format. So what they do, they will check whether you have an introduction, whether you have described the relations of this particular organ, and whether you have described the cause of this particular organ, otherwise whether you have described the blood supply, venous supply, nerve supply of this particular organ. So they will separately give you the marks for each and every point. So imagine you are supposed to describe the thyroid gland anatomy. So you will give the introduction and you only write about the relations of the thyroid gland for your answer. Okay, so you will write up one paper of relations of the thyroid gland and finish your answer. So then what will happen? They will check your paper and you have the introduction and the relations of the thyroid gland only. So you don't, in your answer, there is no blood supply, so no lymphatic drainage, so no some clinical significant of thyroid gland. So for those parts, you won't get the mark. So this is not to stress you, but to encourage you to write a uh, correct answer for the SCQs. Okay, so always try to remember to follow this format to get the maximum mark for a particular SCQ. Otherwise, you will waste half an hour on a particular SCQ and you won't get full marks. So try to get full marks. Okay. So time management is very important. So if you have if you have 6 SCQs, then mostly they will give 3 hours. So if you are exceeding half an hour for a SCQ, don't go beyond that. Move to the next one because you can score more in the next question. Other than waiting in the particular previous question. So if you take the SCQ paper, so read superficially one by one and select the SCQ is which is more easy for you to write the answer. Mean the thing you know. So don't try to answer the first most difficult question. Otherwise, the things you don't know because you will waste your times. Okay. So whatever the thing you know, write that SCQ first. So that is another tip. Then you will have a confidence to continue and you will score more marks on that particular SCQ. But on that particular easy SCQ, so SCQ also don't waste more than half an hour. Okay, so don't spend too long on the SCQ at the cost of others. Okay, then so this is the uh, format for the short notes. So imagine there's a short if you are supposed to write a short note on something, so we have to if they ask you to some clinical condition, imagine you are supposed to write the clinical short note on carpal tunnel syndrome. Okay, so now you have to follow this order and you have to write at least 2 sentences for each and every part. So definition, you are going to tell this is carpal tunnel syndrome is a condition where the median nerve compression within the carpal tunnel. So you have given a definition. And etiology, you can tell this condition is more common in obese people in the pregnancy and also in hypothyroidism because of the vulnerability of the compression of the median nerve within the carpal tunnel. I'm again telling you, I'm not stressing you. Sometimes you may have poor knowledge about this example. I mean, this carpal tunnel syndrome, but don't worry because sometimes you may get that same question, sometimes you won't. So don't worry, just I am telling the example. So pathogenesis, if you know what is happening, just we can tell it's again the compression of the median nerve and clinical features. So if someone is having carpal tunnel syndrome, what are the things that particular patient can experience? So you can simply tell you will have wrist pain and numbness of the fingers, which is innervated by the median nerve. And we have a thing called thin eminence in the hand. So you will have the thin eminence wasting. So these kind of clinical features you can tell. So diagnosis and complications are some advanced things. This is because this is a common format. But if you don't know the things you can write, the complications mean, so you can have the prolonged disability because of the carpal tunnel syndrome. So like that you have to tell. So imagine this format can be applied for any of the uh, clinical condition, but imagine if you are supposed to write the short notes on sciatic nerve. Okay, now this is not the clinical condition. This is the anatomical structure. Then again, you can go back to that previous one. What we have to give the introduction, and we have to, if in case of a nerve, we can tell the cause, distribution, and the branches. And ultimately, definitely there should be the clinical importance of the sciatic nerve. Okay, the clinical important thing is regarding sciatic nerve is the sciatica. So we have to describe something regarding sciatica. So like that. So what you have to do, if you see the SCQ, take the extra paper and write your format and try to fill that one. Then you won't miss any of this category. And at the same time, if you have mentioned at least single sentence for each and every category, so you will get the full marks for your SCQ. Otherwise, if you waste on your time on this definition and etiology, so if you are not writing other categories, so you won't get full marks. So remember, again and again I am telling, so you have to do that. Okay. So another category, the drawing. So sometimes they will ask you to draw something. Okay. So it should be a clear drawing. So there may be the colored paints or something, anything, but um, here, yeah, definition mean so there's a question that among these 6 categories, the introduction needed, like, so for the definition, we can replace this introduction by the definition. So this is the format for a clinical condition short note. Like imagine write a short note on carpal tunnel syndrome, otherwise compartment syndrome, otherwise something wrist drop. Okay, so if you are supposed to write those kind of things, so you have to follow this format. So if you are supposed to describe the gross anatomy, you have to give the introduction and the relations. And in case of it's a nerve, you have to tell the cause and the branches. And ultimately, you have to describe all the blood supply, lymphatic drainage, nerve supply, and ultimately the clinical importance of that one. So again, back to this drawing part, it should be a clear drawing. So if you are supposed to draw the cross section of the mid arm, so that is the example for this one. Okay, mid arm cross section. Then it should be a clear drawing. So after your drawing, at the bottom, you have to write what is this one. Okay, always think so. Examiner who is marking your paper doesn't know anything about anatomy. Okay, that's how we have to imagine. So we always think, they know the things, so no need to write. But draw the diagram. So at the bottom of the diagram, write what you have drawn. Like this is a transverse, otherwise cross section of the mid arm, and other thing is it should be underlined. Okay, you have to underline it, like it's like your topic, and you have to underline it. Okay, and the structures within your drawing should be named with the simple arrows. Okay, then other most important thing is you have to mark the side. So which is the anterior side, which is the posterior side, and also what is the superior one, what is the inferior one. So like that you have to mark. So I will show you a example. Okay, this is an example question. So Draw a label line diagram of a transverse section through the arm in the lower half to illustrate the arrangement of the muscles and neurovascular structures. Okay. So another point I want to highlight here we have sometime mostly they will mark, so they will give the marks and they will mention the marks for each and every SCQ. So this content, so they will give 40 marks. So by looking that one, you have to understand the gravity of this question. Okay. So I will explain. So we have the SCQs again. So I will show you that one. So first, draw a label diagram. So read the question carefully. Draw a label line diagram of a transverse section. So you have to underline and highlight through the arm in the lower half to illustrate the arrangement of muscles and neurovascular structures. So now I am going to draw. Okay. So this is a example picture you have to draw. So like that. So here I have mark which is anterior and which is posterior. And this is medial and this is lateral. So like that we have to mark. And I have marked the particular structures which can be seen in this cross section with some simple arrows like this. And I have named the structures like cephalic vein and humerus I have mentioned here. It's okay. You can use that method also. And here I have the ulnar nerve and here I have the triceps brachy like that. So to complete your drawing, so you have to mark each and every structure. And at the bottom, you can see I have named this one as a transverse section of the mid. So this part is not there. It should be the arm. So should be there. So like that, transverse section of the mid arm is there. So imagine you have drawn something like hepatobiliary system, extra hepatic part of the biliary system. You have to draw. So you have nicely named the structures and you have mentioned the anterior and posterior, whether it's lateral or medial. But if you don't, so if you forgot to name this one, so you will lose some marks. So like that, to get the complete marks for a particular drawing, you have to complete this each and every task. Clear should be a clear drawing. Diagram should be normal name and name should be underlined. Structures should be name and with simple arrows, and the site should be marked anterior, posterior, like that. Other thing is for these kind of gross anatomy or short note, you can have a aid of this diagrams. So if you are supposed to describe the anatomy of the thyroid gland, so at the end, if you have the time, it is better to draw something like quickly draw some anterior neck part and some thyroid gland and try to name this one, this is thyroid gland and these are the lobes, this is right side, this is left side, and these are the branches of the blood supply like that if you have time. So then you will get some additional marks. So this is you have to do if you have the time. But anyway, it is good to do because you will get some additional marks for your drawing if you are supposed to describe some anatomy at the same time some short notes. Okay, so this is one. So now we will move to some examples for the SCQ question. So these are some examples. So don't be confused, please, and don't be stressed. So I am going to show how to answer this question, but not to stress you. Okay. So here. No, sometimes, so there's a question, the drawing is only when they are asked to draw. No. So there may be this kind of question, draw a label line diagram. So there is a direct question, they are asking you to draw. But imagine there's a question, describe the gross anatomy of, um, imagine the bladder. Okay. So then you will follow that format, the introduction and the relations and the blood supply and the lymphatic drainage and the nerve supply and ultimately the clinical significance. So as a aid to your answer, you can draw. So that drawing will get some additional marks. But remember, if you have only half an hour for that particular SCQ, don't waste the time on your drawing. Just go to the next one. So if you have the time, draw a relevant picture for that one. That will get an additional mark. So this is another one. They will directly ask you to draw. Okay, that's just two different stories. So here, now, this is a question, the common question in kind of neuroanatomy. So we will be discussing this one. Now, we have the 35 years old man. So now the clinical, so now I will tell you how to approach this question. So this is regarding 35 years old man. Now he had chronic headache and found to have aneurysm of the right posterior communicating artery. And on examination, his right pupil was dilated, eye movements were unaffected. He has diagnosed to have internal ophthalmoplegia caused by partial lesion of the oculomotor nerve. Sometimes, if you read this question, you may know nothing about this one. Okay, so you are completely clueless about this uh, SCQ. But keep calm. So there are multiple part of the SCQ. So we will, sometimes there may be the question completely not relevant to this one, but you can answer again. So see, now they want you to write the first one, illustrate the arrangement of the circle of Willis. So for this, when you are reading this clinical scenario, so you won't think you will be question regarding this circle of Willis. So now, if you, the question is difficult, but the first part is easy. Now again, I have to highlight the keywords in this clinical scenario. At the same time, I will highlight these things. Illustrate, and here I have the state, and here I have the draw, and the describe, and state again. So if we go to the highlighted one, so this will be our question. So remember, I have identified some key points of this SCQ. So those are 35 years old, chronic headache, an aneurysm of the right posterior communicating artery, and right pupil was dilated, eye movements were unaffected, and there's a word called internal ophthalmoplegia and caused by partial lesion of the oculomotor nerve. So I have highlighted some words. So likewise, in your exam, take the SCQ and use your pen and highlight or something, highlight on the paper and identify the keywords. And again, highlight on this SCQ, the parts of the SCQ, what they have asked you to do. The first thing is illustrate. The second one is the state. And the third one is the draw. And the fourth one is the describe. And the last one is again the state. So illustrate the arrangement of the circle of Willis. Circle of Willis. So what we have to tell. So the meaning of this illustrate mean, so you have to elaborate on this one. So you can use diagram. Otherwise, you can describe with simple sentences, but better to use the diagram as at the same time use some sentences and describe that one. So here we have 25 marks. So we have to understand the gravity of this answer. 25 marks. Here we have the 20 marks. And here we have the 30. And here we have the 10. And here we have the 50. So the least time you should spend on this CQ for the last one. Because why? It has only 10 marks. Okay. So that's how you are going to manage your answers. So first, illustrate the arrangement of the circle of Pillai. So what is it? So now you can see it is completely different from your this clinical scenario. So if you don't know anything about this clinical scenario, you at that moment also you can answer to this question if you know about this circle of Pillai. Now, what is it? So, for example, it is the main center which is located in your brain, which regulate the blood supply for the all parts of the brain. Okay, so it has been arranged as a circle. So it is formed by the multiple arteries, which is coming from anterior and posterior part of the brain, otherwise the head. Okay, so I assume that you all know about this circle. So this is it. Okay. So what we have here for the circle of Willis, we have this sorry. This posterior cerebral artery. So this is the one. So bilaterally we have two. This is right side. This is left side. And again, we have this internal carotid artery to form this circle. So here it is. So bilateral means the both side we have these two. And anteriorly we have this anterior cerebral artery. So these are the structures which contribute to form this circle. Okay. And these are the main three structures. That is the posterior cerebral artery, internal carotid artery, and the anterior cerebral artery. And remember, so these arteries are interconnected to form this circle by this posterior communicating artery, like this in this side, and here like this inside. And we have a thing called the anterior communicating artery. Okay, so if you are supposed to illustrate this one, simply you can draw these kind of two lines, and again we have to draw this kind of two major cylinders like this, and anteriorly like this. Then you can interconnect each and every structure by doing this. Okay, so these two also can be. So this kind of simple diagram is enough to get full marks. Okay, then what you have to write? So you are going to write this is the circle of Willis and underline it, and you have to name with the simple arrows these marks. So what are these structures? You have to tell. Okay, so what are the structures formed in the circle of Willis? Internal carotid artery, posterior cerebral artery, and the anterior cerebral arteries. So these arteries are connected, otherwise communicating through this posterior communicating artery and the anterior communicating artery. So these two. So you can draw this kind of simple diagram, and to illustrate that one, you can tell what are the arteries contributing to form this circle. At the same time, how they are connected by this posterior communicating artery and the anterior communicating artery. Okay. So now the second part, state the different components of the oculomotor nerve, relevant nucleus and the structures innervated by each component. Use the format given below. So there is a format, I will show you that one. So this is the second one. Now they want to state. State mean you have to just mention using some few sentences. Okay. So because they want to know the different component of the oculomotor nerve. So then what you have to do, you have to name the component number 1 and component number 2 like that. And you have to write what is the component here and what is the second component like that. So that's the meaning of state. So here you are not going to write the paragraph and you are not going to describe long descriptions related to this question. So we will see. So we have the first one, components of oculomotor nerve and relevant nucleus. So what are the nucleuses? Nucleus regarding to this oculomotor nerve and structures innervated by each component. Sometimes you don't, you may not know the answer for this. All the components of the oculomotor nerve, you know, but relevant nucleus, you don't. But don't give up. Write what you know. If you know the component, you can write. And the structures innervated by the each and every component, you can, if you don't know all the component, so what you can do, you can so oculomotor nerve innervate the extraocular muscles, some extraocular muscles. Then you know some answer, you can write. Okay. So for example, when we are discussing about the cranial nerves, what we have to know, cranial nerves are initiated at the level of the brainstem. So anywhere of the brainstem, in the midbrain, pons, or the medulla, that is the initiating point. Otherwise, the origin of the cranial nerve. Okay. So what we have to understand, there may be nuclei for this cranial nerves. Imagine, so there is a particular nucleus located in the brainstem. This is the nucleus for the oculomotor nerve, and another one is there. Okay, so what the oculomotor nerve does, it will take the nerve fibers from both nucleus like this and form a single nerve, and it will go towards the structure which is innervated by the oculomotor nerve, and again it will branch into different branches. So this format will be applicable for every cranial nerves. For example, another nerve is there, like for example, it is a facial nerve in case of. So for the facial nerve, we will think there is a 3 nucleus like this. So then what the facial nerve does, it will take the innervation from these 3 nucleus and form a single nerve, and it will go anteriorly, and what will happen, it will branch into several branches to perform the function. So this is what you have to remember regarding the cranial nerves. So they have the nucleus. Those are located in the brainstem. It can be midbrain, pons, or the medulla. And from each and every nuclei, they will take the fibers and ultimately form a single nerve. And at the end, they will branch into several branches and give the nerve supply for this one. So with this example, I will explain bit regarding these cranial nerves. So, what we have to understand, cranial nerves have several functions. The first function they do, some cranial nerves have the motor function. Motor function mean the movements of particular muscles. So that's the meaning of the motor functions. No. Other thing is sensory. Sensory mean what we feel. Okay, so if we feel something, that is called sensory. It can be the pain, can be the temperature. Otherwise, it can be the hearing. Otherwise, it can be the taste, like that. Other thing is, there is a thing called parasympathetic innervation by this cranial nerve. Okay, so some cranial nerve have only motor function. Some have only, so for example, only motor function, hypoglossal nerve. Hypoglossal nerve is the 12th cranial nerve. So remember, this is not to stress you, to give you an overall idea about this SCQs and some particular important parts. So then, what we have, hypoglossal nerve only motor and some only sensory. Those are, for example, vestibular cochlear nerve. And some have all the function, parasympathetic, motor, and also some sensory functions which done by the facial nerve, like that we have. So here we have different components of the oculomotor nerve. Then I am going to describe. So different components of the oculomotor nerve, those are called somatic, motor, voluntary. We can mention the motor functions. We can just mention it is motor function, and it has the thing called parasympathetic fibers. Okay, so it has two components. So the relevant nucleus is the oculomotor nucleus, and so remember, this is oculomotor nucleus, for example, and this is the Edinger-Westphal nucleus, which a particular oculomotor nerve get the fiber. So these are the two nucleus for this oculomotor nerve. Then what we see, by the motor component, it will supply this. These are the muscles. So you know, for the external eye muscles, the main nerve is the oculomotor nerve. So we have the superior, medial, and inferior rectus, and there's a thing called inferior oblique. And for the parasympathetic component, it will supply a thing called constrictor pupil. So if you if you haven't heard about this one, if you are not remember this one, after this class, please read around this one, but don't be stressed. Sometimes this may come to exam, sometimes may not. Okay, so don't worry. Okay. Then we describe the different components. Those are motor and the parasympathetic, and relevant nucleus. Those are oculomotor nerve nucleus and the Edinger-Westphal nucleus. And the structures innervated by each and every each component I have described here. So like that, what they have asked you to do, I have exactly done. Okay. I am not going to describe anything, but I have just stated those answers. Now, there's another one, the third one, draw a transverse section through the relevant area in the brainstem to illustrate the arrangement of the oculomotor nerve and its nucleus. In the same section, illustrate the arrangement of the ascending and descending fibers. So this is a bit complicated, so we'll keep that one. Describe the mechanism of the internal ophthalmoplegia causing pupillary dilatation in posterior communicating artery aneurysm. So this is the next part, and state another intracranial location where the oculomotor nerve commonly affected. Okay, so this is the cross section, so we will keep that for a moment. And now they are asking if there is a mechanism of internal ophthalmoplegia causing pupillary dilatation in the posterior communicating artery. So forget about this internal ophthalmoplegia, pupillary dilatation, everything. So what will happen if there is damage to the oculomotor nerve? So we have the list of clinical presentation. So definitely there will be a pupillary dilatation because the function of the oculomotor nerve is constrict the pupil. Okay. So once the function of the oculomotor nerve lost, what will happen? The opposite action will be increased, then pupillary dilatation will be there. Like that, we have to balance and answer that question. So here we have in posterior communicating artery aneurysms, oculomotor nerve outer part is compressed. The oculomotor nerve outer part contain parasympathetic fibers to the ciliary muscles and constrictor pupillae muscles. Due to the compression of the parasympathetic fibers by the aneurysm, the parasympathetic fibers innervation is blocked. Sympathetic innervation is spared. The innervated circular muscles are constricted. This results in pupillary dilatation. Internal muscles of the eye are affected, hence it is called internal ophthalmoplegia. So remember, in the neurology, they will give you a presentation like this. So whether they will tell pupil is constricted, then you have to understand if the pupil is constricted, you have to understand the groove which contribute to pupillary dilatation has been affected. So if the pupil is dilated, what you have to understand, the groove, otherwise the nerve which is responsible for the constriction of the pupil has been affected. Like that you have to argue. So this is the pathway of the oculomotor nerve as a part of this answer of this question. Oculomotor nerve, it is initiated at the level of the brainstem, usually in the midbrain, and it will go anteriorly and through the cavernous sinus. There is a structure called cavernous sinus, and it will supply this anterior eye muscles at the same time the pupillary constrictor pupillae muscle. Okay. So these are the examples. So don't be confused. So you have the time, you have enough days to complete these things, and you will get the marks. So this is another one. Another example question. Briefly explain the following statement. So they will give these kind of question. So a patient with hemisecting of the spinal cord showed contralateral loss of the pain and temperature sensation and the ipsilateral loss of discriminative touch below the level of the lesion. Okay, so this is the another example you have to answer so you can understand. Hemisecting means we are cutting a part of some structure. Hemisecting of the spinal cord mean one half of the spinal cord we have damage. Contralateral mean opposite side. Ipsilateral mean same side. So these are the words they are using for the neurological SCQs. So pain and temperature are the sensation which carry through the, if you know, the lateral and anterior spinothalamic pathways, and discriminative touch is by the dorsal column pathways. So these are some basic neurological questions. So we have to explain this one. So briefly explain. So only 15 marks. So with the few sentences, we have to tell what is happening here, why this is happening. So then we can tell pain and temperature sensation are carried in the sensory cortex through the lateral spinothalamic tract. So there are things called first order neuron, sensor receptors. There are cell bodies lining the dorsal root ganglion. So it enters the spinal cord from the posterior root immediately, synapse with the second order neuron at the substantia gelatinosa. Second order neuron will go to the thalamus. So it will synapse there, and the posterior horn, otherwise dorsal column fibers, first order neuron will enter to the spinal cord, and they won't cross to the opposite side. They will go up to the medulla oblongata, then only they cross to the opposite side. Because of that reason, hemisection of the spinal cord the pain and temperature can affect to the same side, but the contralateral side mean opposite side, dorsal column pathway to the same side. So if you are recording this one, take the photos and try to understand the concept behind that. So I am not going to deep into the theories because I want you to tell how to answer this one. So if I am going to describe this one, it will take more time. So if you have any doubt regarding any question, so you can mention in our chat. So this is another format. Again, we have a thing called draw a line diagram to illustrate the structures piercing by the needle during the peritoneal tap in the left iliac fossa. So we know this is regarding the abdomen. Okay. Now you know the left iliac fossa. So left iliac fossa means the lateral side of the abdomen. Now they are asking to draw a line diagram to illustrate the layers of the lateral abdominal wall. So this is simple now. So again, I have highlighted. Draw, describe, state. Now for the first one, I am going to draw a diagram. Okay. So I am inserting a needle from the skin, penetrating the deep structures towards the abdomen. Then they are asking what are the things I am going to pierce. Yeah, if possible. So there's a question when we are describing this question, a patient with hemisecting of the spinal cord short contralateral. For this question, if you are supposed to draw the pathways, it means the spinal lemniscus pathways, whether you have to draw or not. But remember, read this one, only 15 marks. Okay, so if we have the low gravity for this question, so if you have the time after for this to complete this SCQ, you can draw. Otherwise, no need for this one. Okay, because we are supposed to briefly explain the things related to this one. Okay. Again, back to the next one. So again, we have to draw a line diagram. So what we have to remember, we have to draw the diagram. We have to name the diagram with the simple arrows, and we have to mark the site, anterior, posterior, inferior, and everything. And at the bottom, we have to write what is this one and underline it. Okay. So always imagine the examiner doesn't know the anatomy. That's how you have to answer. Okay. So this is the highlighted question. And this is the diagram you have to draw. So in related to this question, I have named this one as a longitudinal section of the abdominal wall. I have marked the superficial surface and the deep surface. And from here to here, I have to name the structures. What are the things I am going to pierce when I am doing this thing? The first structure is the skin. So that is common. So you can remember that one. And next you can tell the superficial fatty layer. So you know what is underlying is skin, the subcutaneous tissue. That is superficial fatty layer. And we have 3 layers of muscles in the lateral abdominal wall. So first thing is the external oblique muscle. And the second one is the internal oblique muscle. And the third one is the transverse abdominis muscle. So here I am telling again, I am not going to stress to you, but you have to remember this one and work on this kind of question. Then ultimately, again, another layer is there that is called extraperitoneal fat. And finally, you have a thing called parietal peritoneum after this transversalis fascia. So remember, now when you are in your exam, you have given this question, but you don't know all the layers of this anterior abdominal wall, otherwise lateral abdominal wall. So what you have to do? If you know the skin, you can draw. And if you know the next one is the subcutaneous fat layer, you can tell. Then, by the chance, if you know these external oblique, internal oblique, transverse abdominis, there are three muscles, you can draw this one. And if you can't remember this extra peritoneal fat and this transversalis fascia, so you draw this one and ultimately you can mark the last one, the parietal peritoneum. Okay. So if you have marked at least 4 or 5 things, you will get some marks. Sorry? Okay. So rather than skipping this question, draw something. Okay, if you can't remember anything, draw something. Just mention it is skin and subcutaneous layer. Then you can get the marks. Okay, so that's how you have to draw this one to completing this the necessary information. Second one, describe the embryological basis of the blood supply of the colon. So this is can't help, but you may face this embryological and histological question in the KDU SCQs. So we can't help that one. They will repeatedly question you regarding this embryology and the histology uh, as a part of this SCQ. So we can't help. So whatever things they will ask, we have to answer. So we will keep for that as a for example SCQ, because if I am going to describe that one, you will be stressed more. So last one, state the 5 characteristic features of Meckel's diverticulum that also related to the embryology. So I put this question as example to mention that you will get more as a part of SCQ, there will be a embryology, otherwise the histology. Okay. So if if I record in this one, take the photo. So these are the structures pierced by the large bone eating during the peritoneal tap. Otherwise, simply they are asking what are the structures in the lateral abdominal wall. So these are the structures. And this is the answer for the second one. I'm not going to read. This is the answer. This is the answer for the last one. Okay. Now we will move to the thing called MCQs and tips. So you will have the true and false MCQs in anatomy. Okay. Then you will have the minus marks if you mark the wrong answers. So remember that one. So for example, this one regarding the shoulder joint. So you have to mark the true and false regarding this one. So don't try to mark for this all the 5 statements. If you don't know, leave it. Don't try to mark that. If you falsely mark that one, and you will get the minus marks. So remember that one. So in this MCQ, if you know only these 3, this one, and this one, mark that is whether it is true or false. So you know the answers, no? So that's all. Don't going to mark this B and C if you don't know. Because if you mark this one and if the answer is wrong, you will get the minus marks. Then you won't get mark for this one, no? And again for this one, and only you have a single mark for this last statement because there is a minus mark. So rather than, it is better if you know three sentences, so three statements, please go with those three statements and you mark it. Don't go for other two. Remember that this thing very carefully. So don't try to mark if you are not if you are not very confident, if you know all the exact answers, don't try to mark all the five statements. So that's the first thing you have to remember regarding this true and false MCQs in your paper. Again back. Anatomy statements are fact-based. Okay, so nerve supply, blood supply, relations, boundaries. Okay, so in your statement, a single wrong term, example, median nerve instead of the ulnar nerve. So they are telling median nerve supplied the medial half of the hand. So then if they replace the word with ulnar nerve, that is false. So definitely that is false. So if that is a single wrong term, that completely the statement is false. So half of the statement is correct, one half of the statement is false, completely false. So remember that one. Okay. So what the keywords? So they are try to trap you using these keywords. So remember, they will ask always, never, only, usually, false, very few absolutes in anatomy. Okay, so these things, if you see a question regarding always, never, only, so mostly these statements are false. So these are the very important tips, remember. So mostly these statements are false. So remember, for example, so okay, I will give example. And sometimes you will have these words, all, entire, whole. These are suspicious. Okay. So these are intermediate words which have some suspicious things. Most structures have exception. Remember, all the small bowel parts are supplied by this artery, like this. So we have some suspicious things. So whether it is correct or not. Okay. So these words, usually, mainly, commonly, more likely true. Because if you use these words, we can argue. Okay. So if someone is telling, usually the the what shoulder joint uh, dislocated in the inferior part of the shoulder, usually. Otherwise, commonly shoulder is dislocated to the inferior part. Otherwise, commonly inferior dislocation of the shoulder joint is common. Like that, if they are telling, so it can be a true one. So it is true, but these words, they are using for the true statements. So careful about these one, always, never, only, mostly these are false statements, but you have to work on whether using your knowledge. So if you are given a MCQ, use some systematic recall mentally to identify whether it is correct or not. So the radial nerve supply all the extensors of the wrist. Recall, yes. Radial nerves supply the all extensor. So you have to think, yes, extensors are supplied by the radial nerve, and we have the flexors of the arm. Those are supplied by ulnar and medial nerve. So this statement is correct. Like that, take some few sentences. So you have 2 minutes for a particular MCQ now. So take some seconds and work on this one. Another one. The glossopharyngeal nerve supply motor to the stylopharyngeus muscle and palatopharyngeus. So this is a kind of difficult question. Recall, we can think this is stylopharyngeus muscle. Like that, work on this one and you will, so imagine the total picture. In the previous question, radial nerve supply the all the extension. Then you have to remember, work on that one. Okay, if these extensors are supplied by radial nerve, what is the supply for the flexor compartment? That is ulnar nerve and the median nerve. Then only automatically this answer will be true. Like that, remember. Break down the multi-part statement. If even one part is incorrect, the total statement is false. Remember that one. For example, the femoral nerve supply the sartorius, quadriceps, femoris, and the obturator externus. The first two are correct. Okay. So these two are correct, but obturator externus and the innervated by a obturator nerve. So this half is false. So what we have to do? Then that is completely false. So you have to take it as a false. Okay, so one part is correct, then we have to mark this as a true. That's completely wrong. If the part of the sentence is false, completely false. Remember that one. Okay, so if we are going to work on the MCQs, so most tested anatomical areas are there. So nerve supply and the blood supply, relations of the structures, usually for example, ureter, cranial nerves, those kind of things, development of developmental structures, boundaries of the spaces. Those are the most frequently questions area in the anatomy. Okay, so then we have to work more on these structures to identify what are the things we have to study. But remember, again, I am telling, don't try to mark all 5 statements. If you know 3, that's okay. Leave other 2 and go to the next question. And in the second round, you can work on this other 2 statement, but if you are not sure, leave it. Then you will get more marks rather than you are marking all the 5 statements in your MCQ paper. Time saving exam technique, don't waste. Make quick guess if needed, return later. Trust first unless you remember a clear section. Whatever you mark the first thing, or you work on that one, you mark a statement as true, then don't argue again and again on that one, leave it and go to the next one. If you have any very good knowledge other than that one, don't argue on a particular statement. That's what we are telling. So for example, the muscular cutaneous nerves supply coracofacialis, biceps brachii, and the brachialis. So imagine, for example, if this is not correct, so only this muscle is supplied by another nerve, the total statement is false. But fortunately, all the muscles are supplied by musculocutaneous nerve, so it's true. So lingual nerve carries the taste from the anterior 2/3 of the tongue. So what is there? We have carries the general sensation taste where the coda tympanic branch of the facial. Then inter Okay, again, here what we have, the right lung has 3 lobes and 2 fissures. So that's true. If you are not sure, don't mark it. Okay, then leave it and we will move to the next one. So like that, we have to work on that one. So this is the example, okay, regarding the shoulder joint. So regarding shoulder joint, now they will question you regarding various part of the shoulder joint. So you have to be ready with that when we are reading the first step. Abduction of the arm is initiated by the deltoid. So this looks correct, but it isn't. Okay. So if you are not sure about this one, leave one. The part A, you are going to leave that one. Okay. So it's a ball and socket type synovial joint. So with the common sense, you can understand it's a yes, it's a ball and also there's a socket and synovial joint. So if you are if you definitely sure about this one, so you are going to mark this as true. And they will give like this one. So number 1, and there will be 5 circles for 5 stems like this, 4 and 5. Then you have to put the cross. Can be not the cross, it can be, you have to mark it is true or false like this. So again, be careful whether you are marking on the particular relevant question. So if you mark the answers for the first question in this boxes in the for the second one, then what will happen? Again, you will completely lose the marks. So no one accept, no one understand what you have done. If you know if you have the knowledge, whatever, if you made this mistake, you won't get the marks. So check when you are answering the first question, whether you are going to mark on the answer paper for the first question, not for the others. So the third one, now I am going to third one. Dislocation can be lead to wasting of the shoulder joint. Okay, so now definitely, okay, I know the answer for this one, then I am going to mark this is as true. So it is weakest on the inferior aspect. So I have heard something about inferior dislocation is common in the shoulder joint. So now I am thinking whether to mark this one or no. So again, okay, this one also I am going to mark, this is as true. So I am labrium glenoid labrium is the main stabilizing factor. So these kind, careful about these main, mostly, only. So these are kind of suspicious one. So now I don't know answer for this A and the E. So I am going to leave it. So confidently I know B, C, and D are correct. Then I am going to leave this one. Then I have these 3 marks. Okay. These 3 marks definitely I have. Now I don't know about this one, E, but I can't keep and I am going to mark as this one as a true. So actually this is false. Okay, but I am going to mark this as false. Then what the examiner do? Okay, this one has marked as the false, but this answer is false. And I have 3 and minus 1. Again, I have only 2 marks. First one, abduction of the arm is initiated by deltoid muscle. That also false, but I have a mark as a true. Then what will happen? Again, another minus mark. Then ultimately, I will have only 1 mark for this MCQ. So don't do that. If you are sure, mark only 3, at least 2. Okay. So this is another kind of one. So this is a broad question. Now we were discussing about the particular structure here, the shoulder joint, but here they are talking about the various part of the nerves of the arm. Okay. So medial epicondyle fracture can damage to ulnar nerve. So these kind of things can damage to, mostly true. Okay, can damage to ulnar nerve. So in practically also we know if we touch the medial epicondyle of our hand, we have some tingling sensation because of this ulnar nerve. So it is true. Can be. Radial nerve does not supply the muscles of the arm. So we don't know whether it is supply the muscles of the arm. So we will leave it. In the region of the upper limb, accessory nerve associated with profunda brachii artery. That also we don't know. That is a very terrible question, so we don't know. So medial cutaneous nerve of the arm arises from the medial cord of the brachial plexus. So work on the brachial plexus anatomy. What are the branches here and how the medial cutaneous nerve is coming? So we have the roots, cords, and the roots and anterior and posterior thing, the cords. Ultimately, we have the final nerve. So what we have to do, the work on that one, and ultimately we can get the answer for this one. Okay. Then median nerve supply the muscles of the arm. Okay. So if you know definitely the answer for this one, so there is no supply from the medial nerve for the arm. So this is false. So now I have mark 3 again. So what you have to do, leave it and move to the next one. So like that, again and again I am telling, try to answer, keep your answer level at least 3 statement, mark the 3 statement. If you are very confident regarding all 5 statements, it's okay. You can mark. Otherwise, don't go beyond that one. Then this is what we have done and we have asked our student to do and they have passed the exam. The people who are marking all the 5, they don't know with the suspicious, with the doubt, so they can't get the full marks. Now, we will move to the Viva. Viva tips. Okay. So, in the Viva, there will be examiners 1 or there mostly 2, sometimes 3. So there will be a table. One side you will be sitting in front of them, and they will once you get into their room, they will ask you to sit, and after that, they will start questioning you. We don't know what they are going to ask. We can't assume, but mostly there are some specific areas. Now I am going to show you that one. During the Vivas, stay calm, polite, greet the examiners, sit confidently, listen carefully, don't trust. Sometimes questions are tricky. Okay, so, okay. Please describe the, otherwise you will be given some bones. So there is a tray of the bones and you will ask to select one bone from that particular tray. Then imagine now you are going to select the clavicle. So you have taken a clavicle. Then they will ask you to describe the clavicle. Okay, then you have to tell, because always imagine examiners are, they don't know anything. Okay, so you have to tell this is a clavicle, and by looking at that one, you have to tell whether it's the right side or left side. Then follow that structure. I have mentioned you in the SCQs. So you have to give an introduction and you have to tell the location, and by showing the particular part, you can tell this elevation is this one and this curvature is this one, this groove is for this one. Like that you have to tell. Don't stop. Okay. If you stop at a point, the examiner, what they do, they will ask another question. So whatever the things come into you in your mind regarding the clavicle, tell, but don't rush. Calm, keep calm and tell. Tell the good morning, sir. So this is a clavicle. So this is a right side clavicle. Usually the name as the collarbone. Then we can tell this is located in the joint between the acromion of the scapula and the sternum. Like that, we have to give some brief example. So don't stop. So now if you are supposed to describe something related to this clavicle, imagine now you are trying to tell the whether it is right or left, but you don't know. Okay, you can't identify if this is the right side clavicle or left side clavicle. So don't initiate that sentence like, okay, so this is right or left, like don't wait like that. So if you don't know that one, don't try to tell that. Skip that one. Unless an examiner asks, so if you don't know whether it is right or left, what you have to do, this is clavicle located here, and try to show the points of the clavicle, the elevations and everything, and try to describe that one. Okay, so that is how you have to do. Don't rush. Whatever the things come to your mind in order regarding the clavicle, you explain. Don't stop. If you stop, they will break the silence and they will ask something about, then okay. If you don't know about the clavicle now take the scapula and tell me the anatomy of scapula. Like that, they will tell. So they are not angry with you, but they will tell. Okay, so give short structures answer. So now you have here this example, boundaries of the femoral triangle. Okay, so if this is a say a particular question, so just you can start. The femoral triangle is located in the anterior medial part of the upper thigh, and it is bounded by superiorly by the inguinal ligament, laterally by the sartorius muscle, medially by the adductor longus muscle. So this is a short question, no? So then you can stop. Okay. Then if you're unsure, don't panic. Tell, I'm not sure, sir, but I think, and you show your encourage, otherwise your willingness to answer this question. So don't be silent. Tell something, relate what about anything you know about this particular structure. Okay, so that is that one. Answering techniques. Use headings in your mind like that, definitions, boundary. So now I am your examiner. I am telling, please describe regarding the femoral cubital fossa in the upper limb. Then what you have to do? Okay, sir. No, the cubital fossa, it is a triangular shape area which is located in the anterior side of the arm, usually in front of the elbow joint. So you are going to give a brief definition. So it is bounded by these structures, these muscles, then you are going to tell. So if we consider about the contents, there are 4 major contents from medial to lateral. These are the contents. Then you are going to tell. Then what you have to do, you can tell. So the median nerve is the content of that one, and brachial tendon, brachial artery is there. So clinically, sir, we can palpate the pulse here. So median nerve is there. So it can be, if the medial nerve is damaged, like that, you can continue your answer. Okay, but don't, if you are not confident in the continuation, don't tell the false things, then they will catch you. Okay. Point form, long sentences, examiner want to clarify. No essays. Okay, so point form for the definition, another 2 sentences. Boundaries, 2 or 3 sentences, like that. Okay. So if they are, sometimes they will ask you to draw the diagrams. So they will give an empty paper in front of you, and they will try to give you some, ask you draw something. So they will ask something like, okay, can you try to draw the popliteal fossa and show me? Like that, they will ask. Then take the paper, whatever the thing you draw and whatever the thing you know, calmly draw that one and show to that one. Okay. And use proper terminologies. Don't use later. Okay. So don't, for the fifth finger in your hand, don't use pinky like that, those kind of words. So tell it is the fifth finger in the hand. Okay. For the trapezius muscle, don't use words like traps. Okay. And latissimus dorsi muscle, don't use the terms like traps. Sorry, the lats. Okay. So don't use those kind of words. Then examiners will be irritated by using those kind of words. So be careful. Always use anatomical terms. So then they will they will be happy for your answer, like medial structures, lateral, superior, anterior. So for example, here we have the thing called internal acoustic meatus. So if we tell that ear hole, that's false. False mean then examiners think that you are not respecting, otherwise you are not you don't know the answer for this particular question. That's why you are using these kind of ear holes. Then what they do, they will stop you, and so you are telling ear hole, what is the anatomical term for the ear hole? Like that, they will question you. Then you are in trouble. Okay, like that. So this is again the specimens, what tips. So bones. So mention the site, determination, features, attachment, the foraminas, applied anatomy for the bones, for the organs. Sometimes, usually not. Sometimes maybe they are the liver, kidneys. So you have to mention the shape, surface, borders, relations, blood supply, and the applied anatomy. And sometimes in a cadaveric, in the cadaver, they will show you a particular structure. Otherwise, they will give you a picture of something and ask, what is this artery? And if you name that artery, then they will ask, okay, describe this artery. So otherwise, what is this artery? What is this nerve? And describe this nerve, they will tell. Then from the beginning, start. Introduction, origin, give a cause and branches, distribution, and ultimately, as I mentioned in the essays, mentioned regarding this applied importance. So that's what we have to do. So common viva questions in anatomy, identify the side of the bones and the boundaries and contents of important space like inguinal canal, femoral triangle, axilla, and sometimes this popliteal fossa, cubital fossa. Those are the very famous areas for this viva. So some nerve supplies of these key muscles and clinical anatomy. Why middle meningeal artery is clinically important? Why we are learning about this one? Then you have to tell what is middle. So if, suppose now they are asking why is middle meningeal arteries clinically important? So they have asked, but you know nothing about this one. You only know what is clinical, middle meningeal artery, but you don't know about this, why it is important. Then start the answer. Okay, middle meningeal artery is the artery which is located in the brain, and it is a branch of this artery, and usually it supply this temporal area of the brain. Like that, you will continue your answer. Okay. Sometime when you are going to reach the ultimate, the clinical important part, your time is over. Otherwise, sometimes they will interrupt. But if you don't know about anything this clinical important, you can continue your things regarding the anatomy of the middle meningeal artery. Okay, like that. Identify the structures in a given specimen or cross-section. Mindset exam with okay. So you have to identify. So be confident, perfection, even partial answer score. So you don't be silent. You have to tell something. Okay, stay respectful to the examiner, don't argue with them. Please don't argue, because if they are telling something, that's that at the Viva. Okay, so don't argue. So always be polite and respective. Use some respectful words for this in the Viva. Don't guess widely if you don't know. Admit politely that you don't know, but tell, I am not sure, sir, but I think, like that you have to continue your discussion. Okay, so now the last part of your exam, OSCE, otherwise you will have some stations to identify the structures given in each and every part. So for the anatomy, they will give some specimen like axillary region, otherwise the brachial plexus. Otherwise, in the cadaver, they will show you the cubital fossa, otherwise the popliteal fossa. And what they do, if this is the popliteal fossa, so I will upload some example to your group in the real picture. So there is a popliteal fossa. Then what we'll do, there are multiple structures, and what you have to do. So they will mark this structure as part A. Then you have a separate paper related to that particular station. So remember, this is station number 1. So in the question paper, they have given to you under the question number 1, the first question will be, what is the structure marked as A? Then the second one, write the clinical importance of that particular structure. Right? Then there are short answers, few questions will be there. Then you will be given around 2 or 3 minutes for a particular station, and there is a bell, and after the bell rang, what we have to do, we have to shift to the next station, and at the next station there will be another structure. So related to this anatomy, now what they are doing, they will give some slide to illustrate the histology. Okay, so there may be histological slides, and you have to look through that one and identify what are the things available in the histology. And so imagine this is the second part of the second station. So in this paper, the second question will be regarding this slide. Okay, so they will give the cadavers, don't be afraid. So they will mark the structures using this one. So write whatever you think, and you will get the mostly you will get the marks for these OSCEs. Okay, here I will show some so these are the things they usually ask from the anatomy Viva question. So I will share this one. Regarding the clavicle, so they will give you the clavicle. So they will ask, what is this bone? So then you are going to tell this is right or left clavicle. So now you have described it, then you have to start from the top and tell to the bottom. So how do you recognize the superior and inferior surface? Then you have to tell. So what are the muscles attached to it? Reason for its shape? How does the clavicle fractures occur? So these are the questions which they have asked in the past exams. Okay, so remember this will come to you again. So these are things regarding bones, mainly shoulder joint, radius. So we will find another bone thing. Okay, neuroanatomy, head and neck area. So yeah, here we have, tell me about thyroid gland and the nerve supply related to it. So that's how they are going to ask. Then you will tell thyroid gland is endocrine gland located in the the muscular triangle of the neck. Then it is supplied by these nerves. Like that you have to tell. And sometimes they ask these kind of things. What is circle of Willis? Then you have to explain your introduction. Circle of Willis, arterial complex which supply the blood, which is for the blood supply of the brain, and it is composed of. Then you are going to tell the cerebral artery, internal carotid artery, anterior cerebral artery, and communicate it through with the anterior and communicating that branches, and what are the things it will happen if there is damage to this particular structure, the things you have to tell. Then here describe the submandibular gland. You take. Name some extrapyramidal pathways. So what are the extrapyramidal pathways? You have to tell. Then what they do, they will question about the extrapyramidal pathways, and after that they will. Okay, remember. So that's all for today. And so I have given the brief introduction. Otherwise, the tips for this your exam. Remember regarding SCQs again, read carefully. And for the MCQs, don't mark all the statements. And for the Viva, the things what I have told you, and OSCE, the things. So if you have any question regarding each and every part, you can share in the group, and I will share you these example Viva questions and the things for those keys, and the same times some model papers for the MCQs and SCQs. Okay. Okay. Now I wish you all the best for the exam. Don't worry. You have the time. You can do this. You have enough time. Don't waste on some unnecessary theory parts. Use the past papers. Take the time and work on the past papers and most commonly question areas. Don't find for some tiny thing and try to understand those things. Yes. Anyone want to ask any questions? Have enough time to complete this one. We will work on that one. Okay. Okay, then wish you all the best. I will stop here. So if you have any question, if you have any doubt regarding any SCQ, anything related to anatomy, I am ready to answer. Share in the group, the WhatsApp group or anywhere. So I will quickly back to you. If you want to discuss something with me, we will have a discussion or Zoom meeting, and I will discuss the difficult questions, anything. Okay.